Picture this. You're walking across uneven ground. No shoes, no map, no phone. You step wrong, something in your leg snaps. There's no ambulance, no x-ray, no painkillers, just you, the dirt, and roughly 300,000 years of evolution that never prepared your species for hospitals. You'd assume this was a death sentence. For most of mammalian history, it was. A broken leg on the savannah usually meant one thing. You couldn't run, you couldn't hunt, and something else could. But in 1970, in a cave in northern Iraq, archaeologists found a skeleton that broke that assumption completely. This is going to change how you think about what primitive actually means. In 1957, a team led by American archaeologist Ralph Zalecki began excavating Shanidar Cave in the Zagros Mountains of Iraq. Over the next several years, they uncovered the remains of at least 10 Neanderthals, dating back roughly 45,000 to 35,000 years. One skeleton, labeled Shanidar 1, changed the way scientists understood Neanderthal life. This individual, a male estimated to be 35 to 50 years old at death, old age for a Neanderthal, had a shattered right arm. The bone showed signs of a healed fracture so severe that the arm had likely been amputated below the elbow or had withered from disuse after the injury. His right shoulder blade and collarbone showed atrophy consistent with decades of not using that arm at all. He also had a healed skull fracture, evidence of blindness in one eye, degenerative joint disease throughout his body. Researchers estimated he lived for at least a decade, possibly two, after his injuries that should have made him useless as a hunter-gatherer in a harsh mountain environment. A being who could not fully use one arm, who may have been partially blind, survived for years in an Ice Age landscape. That doesn't happen by accident. That happens because someone fed him, protected him, and kept him alive through healing that would have taken months just for the bone itself, let alone the underlying trauma. But here's where it gets stranger. There's a specific injury that anthropologists treat as a kind of litmus test for the presence of real medical care in the archaeological record. The healed femur fracture. The femur is the largest, strongest bone in the human body. Breaking it takes serious force, a fall from height, a collision, an animal attack. And a broken femur is not like a broken finger. Without treatment, a fractured femur is catastrophic. The muscle around it seizes and spasms, pulling the broken ends of bone apart or across each other. Blood loss can be fatal. Infection in a pre-antibiotic world was almost a guarantee. And even if a person survived the initial trauma, without their leg being immobilized correctly, the bone would heal crooked or not at all, leaving them essentially crippled for the rest of their life. A life expectancy measure in weeks, in an environment where mobility meant survival. In 1975, the French paleoanthropologist Yves Coppens co-discovered Lucy, the 3.2 million-year-old Australopithecus afarensis skeleton found in Hadar, Ethiopia, by Donald Johansen. Lucy's skeleton didn't show a healed femur fracture, but subsequent studies of early hominin remains across Africa began cataloging something curious. Individual after individual, with healed, though badly set, long bone fractures. Bones that had snapped and then mended, sometimes crookedly, sometimes not. Evidence that these individuals had survived injuries that, biologically, should have killed them within days. The French physician and anthropologist Paul Broca, working in the 19th century, was among the first to formally argue that a healed fracture in the archaeological record was itself a form of evidence. Not just of injury, but of care. A bone doesn't set itself in a useful position. Someone has to hold it there. Someone has to keep the person still, fed, and protected from predators for the 6 to 8 weeks it typically takes a fractured femur to knit, and far longer to bear weight again. That's not the whole story, though, because surviving the break was only step one. To understand what ancient humans were up against, you have to understand what a body does after a fracture. Within minutes of a break, blood pools around the fracture site, forming what's called a hematoma. Within days, if the bone isn't stabilized, that hematoma can become infected. And in a world with no germ theory, no antiseptic, and no antibiotics, a soft tissue infection following an open fracture had an extremely high chance of turning septic. Sepsis, untreated, kills in days. So the first requirement for surviving a major fracture wasn't medicine in the modern sense. It was stillness, immobilization, And there is direct archaeological evidence that Neanderthals and early Homo sapiens understood this instinctively, or through observation passed down over generations. At the La Chapelle-aux-Saints site in France, excavated in 1908, researchers found an elderly Neanderthal skeleton, nicknamed the Old Man, with severe arthritis, tooth loss, and healed rib fractures. French paleontologist Marcelin Boule originally used this skeleton to argue Neanderthals were hunched, ape-like brutes. It took until the 1950s, when American anatomists William Strauss and A.J. Cave re-examined the bones, for scientists to realize Boule's reconstruction was wrong. The stoop was from arthritis, not species-wide posture, but the healed injuries told a separate story entirely. This individual had lost most of his teeth and could barely chew, yet had lived for years. Someone had to have been softening or pre-chewing his food. Splinting itself, using rigid material lashed against a limb, leaves almost no trace in the fossil record, since the materials, wood, bark, sinew, leather, decay within decades, let alone tens of thousands of years. So archaeologists infer it indirectly. A bone that healed straight, rather than badly angled, is strong evidence that something held it in place while it mended. At the Shanidar Cave site in Israel, a nearly complete Neanderthal skeleton dated to around 60,000 years ago, known as Kabara II, was discovered in 1983 by a team including Israeli archaeologist Ofer Bar Yosef. The specimen showed a well-preserved hyoid bone, the small bone in the throat tied to speech, suggesting Neanderthals may have had the anatomical capacity for complex spoken language. If that's true, it changes the entire picture of ancient bone setting. This wasn't silent, instinctive caregiving. It may have involved someone explaining to someone else, verbally, how to do it. Except there was a problem. Setting the bone correctly required not just stillness, but force. And this is where the story gets almost unbelievable. In 2022, in a limestone cave called Liang Tebo on the island of Borneo, in Indonesian territory, a team led by Australian archaeologist Tim Maloney uncovered a skeleton dated to roughly 31,000 years ago. This individual was missing the lower part of their left leg, but the bone wasn't torn off and it wasn't crushed in an accident. The remaining bone showed a clean, healed stump, evidence that the leg had been deliberately amputated, and that the person had survived the surgery by at least 6 to 9 years afterward, based on bone remodeling. Think about what that required. Someone in a Stone Age society roughly 31,000 years before the invention of antibiotics or anesthesia had to identify that amputation was necessary. They had to cut through living bone and flesh with a stone tool. They had to manage catastrophic blood loss without ligatures we would recognize today. They had to prevent infection in an open wound for weeks in a tropical climate, arguably the hardest environment on Earth to keep a wound clean. And the patient had to survive the shock of it all, without anesthesia beyond, at best, plant-based sedatives. Before this discovery, the oldest known evidence of a successful limb amputation belonged to a Neolithic farmer in Boutier-Boulancourt, France, dated to around 5,000 years ago, nearly 26,000 years more recent. The Borneo find pushed the timeline for complex surgical intervention back by tens of thousands of years, into a period when humans were assumed to be simple hunter-gatherers without organized medical knowledge. Dr. Maloney and his colleagues, publishing in the journal Nature in September 2022, argued that this level of surgical skill implies detailed, transmitted knowledge of human anatomy, knowledge of blood vessels, of which cuts to avoid, of how to manage a wound over time. That's not a lone act of desperation. That's a tradition, something taught, tested, and passed down. But here's where it gets stranger still. Once humans started writing things down, the evidence stops being inferred from bone and becomes explicit. The Edwin Smith Papyrus, an Egyptian medical text dated to around 1600 BCE, but believed to be a copy of a document written as early as 3000 BCE, is considered the oldest known surgical text in human history. It was purchased in Luxor, Egypt in 1862 by American Egyptologist Edwin Smith, and later translated in full by American Egyptologist James Henry Breasted in 1930. The papyrus describes 48 case studies of trauma, many involving bone injuries, and for each one gives a diagnosis, a prognosis. The document describes how to reduce a dislocated jaw, how to treat a broken nose by realigning it and packing it with linen, and how to splint a broken collarbone using rolls of linen soaked in resin, which would harden as it dried, functioning almost exactly like a modern plaster cast, roughly 4,500 years before plaster casts were invented in Europe. Around the same era, in Mesopotamia, medical texts written in cuneiform on clay tablets, some dating to around 1900 BCE, describe bone-setting practices in similarly specific terms, including instructions for applying poultices made of specific plants believed to reduce swelling and prevent infection. In ancient India, the physician Sushruta, believed to have practiced sometime between 800 and 600 BCE, authored the Sushruta Samhita, a text describing dozens of surgical procedures, including techniques for setting fractures and even a form of reconstructive surgery, rebuilding noses using skin grafts, a technique that wouldn't reappear in European medicine until the late 18th century, over 2,000 years later.